Very good evening, friends. Meeting again in the session of Stuart Close philosophy, and we are discussing regarding the chapter the examination of the patient. Two lectures we have spent up till now, and in two lectures, many things Stuart Close tried to explain. Most practical hints, clinical aspects which he tried to explain, or they are giving importance to the which symptoms are important from examination point of view. And then he says the subjectives are more important, which gives the individuality than the objective, but objective are also important at the same time. That's what he has said. And thereafter, in last lecture, we have started discussing about exactly the practical case taking. And while doing the practical case taking, how the physician's approach should be, how he should be very specifically shows his confidence, and patient can get a confidence in you to start with the case. That is more important, and that's why how the physician's demeanor will be, how the way he should behave, that he should be a cheerful, he should not, he should be a confident, he should be a simple, he should be a serious regarding the case taking, all those things, and how he should not be. Both things he tried to explain over there. And those are real things in our practical case taking. Because many times it is not the remedy which is acting, it is you are acting on the patient. And that's why your personality matters a lot. So your behavior, your tone of conversation matters a lot. So all those points he has discussed while discussing that. We were on page number 171. Last sentence we have not yet discussed of that paragraph. So what he says, we should try to put the patient at his ease by adapting ourselves to his personality and mood. Most important thing, last sentence of the same paragraph, we should try to put the patient at his ease by adapting ourselves to his personality. The adaptation should not be done by the patient, but adaptation should be done by yourself to the patient's personality. Means what? The way patient talks is very important. If possible, try to talk in the same language in which the patient is narrating his symptom. At least you must know three languages. If you are in Maharashtra, you must know the English, you must know the Hindi, you must know the Marathi properly. These are at least three languages. If you are in Gujarat, you must know Guju along with that. These are very important because if you try to explain the things in his own way, in his own language, it becomes very simple for him to understand. At the same time, he becomes very much attached with you because of that. I used to do practice earlier in Muslim area. Their language was very typical. The same language I used to use while talking with them. And that's why I made a very good conversation with all of them. I had good practice of Muslim patients at that time. So this matters a lot. You should adapt the situation. It is not the patient should adapt you. You should adapt yourself to the patient's personality as well as to the mood. Mood is very important. You have to understand what, if you see that patient is disturbed, you must go into the same serious mood and find it out what may be the reason behind that. Your question should be proper enough. It should not be that patient is in a very serious mood, disturbed mood, and you are making a joke. No, you have to adapt the situation, and that adaptation matters a lot. So these are very basic qualities which he is trying to explain how the physician should adapt each and every situation while starting with the case. So it's the start of the case, which he is explaining is the start of the case. Then what he says, we should not confuse the patient by too penetrating gaze at some objective feature which may attract our attention. We may learn to observe objective phenomena accurately without seeming to do so. If the patient sees us gazing fixedly at some part of his anatomy, he is likely to become anxious and forget other matters which are more important to us as the prescriber. And he is giving one more information or characteristic, valuable information, that if you concentrate on the anatomical or pathological aspect of the patient and you talk seriously about his pathology, he will going to forget what he wants to tell, and he will again become anxious regarding his pathology, regarding his anatomy, and he will not narrate those things which are essential for you for the prescription. Because the symptom, if you're going to look towards that objective pathology, it doesn't have so much of symptoms. If there is a liver cirrhosis, it is liver cirrhosis. You cannot get anything, any idea for prescription. If there is fatty degeneration of the heart, it is fatty degeneration of heart. You cannot get anything out of it for the prescribing point of view. And if you concentrate, you look toward the patient, your heart is having fatty degeneration, finished. The patient becomes anxious. He considers he is having very big disorder. And then he forgets what to tell you. What are his symptoms? His narration, everything is lost. So these are very essential hints which Stuart Close is giving you, and these are real things. This is more important. It is our duty to make it ease for the patient. Even though he is having any serious pathology, don't show it that it is too serious to him directly. If you show like that, then patient becomes too serious and he never narrate what he wants to say. The same is true of the use of instruments and performance of various acts of physical examinations. A nervous patient will often be seriously disconcerted by so simple a procedure as listening to his heart action with stethoscope, sometimes even by taking his pulse. It is best, therefore, with nervous patients to postpone such examinations until near the close of the examination, or until it is best, therefore, with nervous patients to postpone such examinations until near the close of examination or until he has lost his nervousness. So this is too important. Many patients comes to you, they are in nervous mood, disturbed mood, restless mood, and you ask directly, just lie over there and I will check your blood pressure. They become so much anxious, worried. What has happened to me? And if they don't have a blood pressure, it gets raised. It is the essential hypertension which develops because of anxious moods, nervous moods. So, first important thing is that to get familiar with the patient. He should feel very much ease while talking to you. Then you tell him this, it is just a checkup, we'll do a general examination and nothing to worry about it, and just engage him in talking, and while talking, just check his pulse, check his blood pressure, so that it never reflects on, the part of blood pressure. Second important thing, even though the blood pressure is too high, don't tell directly, your blood pressure is too high. Forget. Patient gets disturbed. Tell them it is little bit increased, it will settle with the time, nothing to worry about, and you just make it very simple so that he can understand the things very easily. The patient should be encouraged to tell his story freely and relieve his mind. Sentence is very important. Tell his story. Every case is a new story for us, for homeopath. And there are many stories hidden which are responsible to produce a disorder in him. And you should be very much careful in listening. Most important quality of a homeopath is he should be a very good listener. If you start listening, you will get more and more female patients. Why? Because no one listens at their home. So homeopath is the good person who can listen them. If you go with the Sigmund Freud, one of his students asked Sigmund Freud, "Sir, you asked the patients to come and tell their stories, and you are doing your own work while the person is narrating, and you are not looking or you are not listening to them. But what is the use of it? He said, they feel that I am listening, that's all. By listening to someone, they feel relieved. Someone at least listens to me. That is the most important feeling. And that feeling itself is the feeling which ameliorates the complaints, which ameliorates the inner turmoil, the whatever is saturated in the emotions that gets narrated, that gets taken out, he gets relieved. So this is too important. This is a new story. I took a case just 2 months back, 3 months back. It was a case of interesting case of chronic renal failure, CRF. It has started with ARF and entered into CRF. And she was very young. It has happened just after marriage. Then there was a divorce. First husband left her, and she was in a agony, and she was lot of disturbances in her life. The kidney was changed. The mother has given her kidney, renal transplantation done. And she again got married, and she wanted her own child, but it was not possible. And then the she kept the pregnancy through the surrogate mothers, and she had twins. The whole story was interesting. And she was very serious because what has happened? Since 6 months, the creatinine again started increasing. Someone told her to meet me, and they came to me. I took her case 2.5 hours, and the whole story I listened. And whole story was literally as if you are listening, you are watching a movie. It was really interesting. You get a number of things. Thereafter, I talked with her. There was good communication between us. And when I narrated all her features, she was so relieved while going from my clinic. And immediately after 15 days, when she has checked her creatinine, it was coming down, and it has reached to the normal within span of 1 month. It was interesting. Listening is a very important thing. And that is what he is explaining over there, that he said the patient should be encouraged to tell his story freely and relieve his mind. We want the history and symptoms of the case from the patient standpoint first. Patient standpoint, that is more important. The way patient narrates, the way patient expresses is very important, because that gives the individuality of that individual, and which gives you a prescription. What disease he is suffering from, that is secondary for you, because your prescription never depends upon that. But it is also important. But first priority should be the listening to the patient from his standpoint of view. If the physical examination is made afterwards, when the patient is composed, there will be less danger of confusing and prejudicing his mind. So you should not go for immediate physical examination. First listen what he wants to narrate. Then just go through all the reports. Then ask him to go on examination table. Then check. While checking, you make the whole environment so friendly that he will not feel that you are examining, and because of which there is no stress in his mind, and you get all those things. When patient was narrating, and in his own words, which gives you individuality of that individual, which will be useful for your prescription, and clinical examination gives you a diagnosis, which will be useful for you for the understanding his disease, the prognosis, the pathophysiology. So all those things depends, and auxiliary line of treatment also depends upon the diagnosis. So things which he narrates is very important, and you have to make the patient more free whenever you are examining. The first part of the examination should be conducting in an easy, semi-conversational manner. See, every sentence has a meaning. First part of examination should be conducted in an easy, semi-conversational manner. The best results from the homeopathic standpoint are obtained by making him forget that he is under examination. He should not feel that he is getting examined. Listen. Basically, for that purpose, you should develop that quality. You listen what he wants to narrate. Make a good rapport with the patient. When you start it with something and then entered into the case, he should not feel that he has entered into the case. That is more important. Then he becomes rather simple, more easy, and then you get what you want. So this is very important. It should be it should not be just questionnaire. What's your name? What's your age? It should not be like a questionnaire. Make a rapport and then you enter into the case taking. That will be more better for you. One can be painstaking and systematic without being over formal. What he is writing is very important. One can be painstaking and systematic without being over formal. So whenever he was writing, taking the case, it should be proper in a systematic manner, so that you will not forget any point from the case. You should write it at a proper place. You should write it in a proper way. You ask right from the origin, duration, progress, whole evolution of the disease that you have to understand. So you should be painstaking. If you know that it will take long time to understand that patient, but you should not make a hurry regarding it. You go on listening. The mere thought of undergoing formal examination is disconcerting to the ordinary patient. Disconcerting means aswastha karne, bechain karne, to make him restless. So if you just go as a formality means it is a mechanical case taking. You ask the patients, what's your name, what's your age, and then in the question paper it has been written sex, and you ask, what is your sex? Patient starts laughing that you are not understanding him. You are just making a mechanical case taking, formal case taking. It doesn't have sense. And that's why it should not be like that. He should feel that, yes, you are really interested in his case. You are really interested to cure him. Most important thing in the case taking is this part. He should feel that you are really interested in his case and you want to treat him. If patient starts feeling this, that's all. You have changed the axis at the dynamic level. He dreads at he dreads it as he dreads going the dentist. Dreads means he fears going to the dentist. There is a rubric in the repertory. Fear going to a dentist. It is a rubric. Because everyone knows that they give the injection in the inside mouth, near the tongue, in the gums, and that it is painful, and that's why there is a lot of fear. And they use as many instruments, and you look where you are during just conscious phase, you observe that, and that's why you are already frightened because of all those procedures. So he dreads as he dreads going to the dentist. He wants to feel, and it is best for him to feel that he is relating his troubles to a sympathetic friend who has resources at hand to help him. Very important sentence. Sympathetic friend, to whom you can share your all the emotions. You can share it only with the friend who is very close to you. You can share that only with such a friend who is sympathetic towards you. And then you share. And that's why your tone of conversation should be a sympathetic. You should be you should talk in a sympathetic manner that make a thing more clear, ease, and makes it very, very much useful for the patient to discuss all things with you. So your tone matters a lot when you deal with the patient. So he wants to feel, and it is best for him to feel that he is relating his troubles to the sympathetic friend who has resources at hand to help him. It is a good rule to keep the patient talking. but say little yourself during an examination. To let him tell his story in his own way, without interruption, except to bring him back to the subject if he disagrees. So, it, what he says is very important. It is a good rule to keep the patient talking and you talk less. If you ask, what's the problem? And just go on listening. Since when you are having everything explain in detail and make a habit of listening, the way he narrates, write it down, the way he expresses, observe him. Observation plays a very vital role. You should not just go on writing, keeping never looking towards the patient. Most good position is sit in this manner, look toward the patient and write it down. If you are watching the patient while writing it down, you will get all those expressions which are expressing on his countenance, and those are expressing the inner emotions of the person, where you get the individuality of that specific person. The person who says there is lot of grief in his life and he's laughing, that it doesn't have a sense. You should not write it down, grief elements from, not at all. The grief you are, where is the grief? You are not watching the grief on patient's face. And that's why reading the face is very important. You have to observe what he is telling is whether it is getting expressed on his countenance, whether it is expressed in his body language. If it is so, it has meaning. If it is not there, it doesn't have meaning. It doesn't carry any sense. And that is what he is explaining over there, that it is good rule to keep him, the patient, talking. Patient is narrating, just listen and just write it down. Make him talking. And second important thing, but say little yourself during an examination, to let him tell his story in his own way without interruption. You should not interrupt, because the train of thoughts which happens to be there in patient's mind gets obstructed whenever you put any question in between. So that should happen, that should come out, and that gives you more proper indications for the remedy. And that's why one should not interrupt the patient, unless, the very important thing, unless to bring him back to the subject if he disagrees or if he disagrees. If he is talking irrelevantly, or he was like a legacy going from one subject to another subject, it is your duty to bring him again on the train. We may start him in his narrative by asking when and how is your trouble began, and we must instruct him to be as definite as possible in relating his history and in locating and describing his sensations as they seem to him. So to start with, if you ask question should be formed in a proper manner. So what should be the question? You should ask in a proper manner. Please tell me right from the beginning, since when you have started the disease, and each and everything in sequence. That matters a lot, so that I will understand your disease in a proper manner. If try to explain the dates so that it will be quite easy. If it is not specific date, at least some months which patient should narrate. If you explain him regarding it, you will get a good history. How do you form a question is very important during case taking. And forming proper questions gives you a proper idea. We should not laugh at him. Very important. Underline that. Nor pedantically correct his errors. Because most important thing, patient, you don't know who is your patient. If you know him, it's okay. But if you don't know him, he's new to you. You don't know his socio-economic condition. You don't know his condition at his house, everything. Many times it happens their language is different, your language is different. Some jokes can happen because of that. But keep it in your mind. Don't laugh to anything on the patient's part. Even though any big joke has happened, don't laugh. And because if you laugh, finished, the patient will not return to you. You should be very serious while patient was narrating his symptoms and anything. Even he uses the wrong words. You should not try to correct it, perceive it. At the end, confirm it. Or if you still feel that if it is wrong, at the end of case taking, you just ask regarding it. Really, do you feel like that or something different? It should not be distressing or disgracing to the patient. If he never get disgraced because of your such types of question, then it's okay. But otherwise, he can get disgraced, and that's the very important thing which he is explaining over there. We should not laugh at him, nor pedantically correct his errors. We should not ask leading questions, nor put the words in his mouth, but let him express his feelings and observations in his own way. So your question should not be like that, which will answer in monosyllables in yes or no. Are you thirsty? You ask either yes or no. Such questions are leading questions. It's better to ask, how is your thirst? Very important thing. It depends how do you form your questions. That matters a lot. So leading questions should be avoided. Afterwards, we analyze, complete, correct, and interpret his statements in accordance with the principles of homeopathic symptomatology as set forth in the former article. So whatever the patient is narrating, just go on listening, writing it down in this very expression. At the end of case taking, it is then you start reading it again, analyzing it, categorizing it into different parts, then evaluating it. That is not the part at the start. So when you are writing, just go on writing in a proper manner, in the very expression. Analysis should not be done at the same moment. It should be at the end. And that's why you should not interrupt by putting any difficult question at the time. Let listen him. If you want to ask anything specific regarding it, it should be at the end. When patient stops giving you the history. So we have discussed many points related with this examination of the patient in today's session. It is a big practical chapter, and we are going little bit slow because it is most essential part of our day-to-day practice. So whatever Close to explain, we'll discuss and learn all those things which will help to grow our practice and understanding of the patient. So that's all for today. Today evening at 8 o'clock, we'll start with C series. The first remedy from C series in the third year is Cactus grandiflora. And cactus is a wonderful remedy. I will share my experiences about the cactus in my practice. It is a wonderful remedy to be learned. So thanks being there. If any query is there, we can discuss. Otherwise, we'll meet at the. So good night and meet again at 8 o'clock.